Hello, students. Next, Bordetella pertussis or whooping cough. These bacteria are small, gram-negative, with slight pleomorphic measures and small size, appear singly in pairs or in small clusters. This bacteria is non-motile and non-sporine. Sometimes we can detect bipolar metachromatic staining if we stain it by toluidine blue. Capsules you can detect in young, fresh cultures. And if you will use special stains such as Burihin stains. In culture films, the participants they arrange it in loops clumps with clear spaces in between, giving thumbprint appearance. Freshly isolated strains of Bordetella pertussis have fimbria. Cultivation, how we will cultivate? First, it is obligate aerob. This bacteria can grow only aerobic condition in presence of oxygen. No oxygen, no growth. Next, the temperature of cultivation 35 till 36 degrees, in 1 degree less than our conventional flora. Complex media is necessary from primary isolation. The medium of choice is Borte Jangu medium. Potatoes, blood glycerol media. Primary isolation of pertussis requires of additional decarcol, ion exchanges resins, and near the 20% of blood for growth for neutralize of growth inhibition effect. The place should be incubated in moist environment. After incubation, during 2 or 3 days, we will detect the colonies on the Borte Jangu media, like a small, dome-shaped, smooth, opaque, misted grayish, glistening, and looks like bisected pearls or mercury drops. Colonies are surrounded by a hazy zone of hemolysis. Confluent growth present on an aluminum pane appearance. What about resistance? Bordetella pertussis is a delicate organism. It can be killed by heating in 55 degrees during 30 minutes. Drying and disinfectants. Outside of the body, this bacteria can survive during 5 days on the glass surfaces, 3 days on the clothes, and few hours on the paper. On this picture, you can see the colonies of the Bordetella pertussis on charcoal agar with supplements for the inhibition for stimulation of growth. You can see this is slight colonies, shining colonies, which looks like a mercury drops on the surface of the media. In this, you can see the microscopy picture of Bordetella pertussis, short gram-negative rods. Next, the differential characteristics of Bordetella species. We have 4 species of Bordetella. 2 species are called whooping cough and para-whooping cough. And Bordetella bronchoseptica and Bordetella avium we can detect in our throat like a common, sometimes causative agent of respiratory tract infection. Next, look how we can differentiate. Bordetella pertussis is characterized long growth on the Jangu media if we compare with Bordetella pertussis and other Bordetella from 3 to 6 days. In comparison, Bordetella parapertussis growth during 2 days maximum. Bordetella pertussis cannot grow on the McConkey agar, but other Bordetellas can grow. Urease are negative for Bordetella pertussis and parapertussis, and toxins are present for Bordetella pertussis, pertussis toxin 2, pertussis toxin absent in Bordetella parapertussis, bronchoseptica, and avium. And agglutinogenes are present in Bordetella pertussis and parapertussis. What about antigenic structure and virulence? Presence of agglutinogens. Bordetella have genospecific and species-specific surface 14 agglutinogens, which helps based by K antigens or fimbria. It's very important for epidemiological studies because we should know the serotypes are circulated in specific landscape or area. Next, pertussis toxin. This toxin promotes lymphocytosis, sensibility to histamine, and enhances insulin secretion. It has toxoids. Toxoid is a major component of vaccines. Filamentous hemagglutinin adhesin mediated adhesion on the cilia epithelial cells. Adenylated cyclase, we can divide it in two parts. Adenylated cyclase, which ability to enter in target cells, AC toxin we called, heat label toxin or dermatonecrotoxin, heat label toxin, but the function is unknown. Tracheal cytotoxin has a special affinity to ciliated epithelial cells of bronchus, induces ciliary damages, and severe cough. Lipopolysaccharide heat stable toxin, its function is unknown in present time. Stages of disease, incubation period from 7 to 14 days. And we divided 3 stages: prodromal or catarrhal stage, very difficult for differential diagnosis between whooping cough and other respiratory tract infection. Paroxysmal stage, after 7 or 14 days, paroxysmal stage begins. And what we can detect? We can detect violent spasm of continuous coughing, followed by long rush in air in almost empty lungs and characteristic whoop. Convalescent stage, we will detect when the frequency and severity of cough gradually decrease, but secondary complication will begin. Complication, what we afraid and what we worried. Subconjunctival hemorrhages, subcutaneous emphysema, inguinal hernia, rectal prolapse, deep pressure effect during the violent bouts of coughing. Respiratory complications such as bronchopneumonia, lung collapse. Next, neurological, like a convulsion and coma. This algorithm of bacterial identification, please attention students. You will take samples. How you can take? You can take nasal sample or a swab from nasopharyngeal area. In small children, what you will take? During the small spasmodic cough, you will open the petri dish consisting the Bartujangu media and put before the mouth, because during the cough, the sick person will spread droplets consisting the Bordetella pertussis. After them, you will put this petri dish in thermostat, incubate during 24 hours, 44 hours, or 1 or 2 days in 37 degrees. After them, check results, re-inoculate insectors. After them, prepare them tests, biochemical tests for urease, tyrosine. Next, prepare the smear for detection pure culture or not. You should detect small gram-negative rod-shaped bacteria, sometimes positioned like plastic or fingerprints. And if you will detect positive result of urease tyrosine, you will tell about Bordetella pertussis, or if negative, Bordetella parapertussis. Principles of treatment. First, you should add antibiotics, of course, because this is bacterial infection. And you should start vaccination in close contact people, and primary vaccination by diphtheria, tetanus, acellular pertussis vaccine. This is a modern vaccine because maybe you know that DTaP is most important vaccine, but characterized by different complications, from the side effects to severe complications, side effects in high temperature, and severe complication, convulsion of the body. And Japan scientists made research and found that complication of this vaccine is according by cellular component of pertussis. They clean this vaccine and put a cellular component of pertussis into this vaccine. And now this vaccine is characterized as less side effects and less complications. And I said that DTaP we will start in 8, 12, 13 16 weeks of primary vaccination. First revaccination in 1 year, 6 months. Second revaccination in 6 years before school.
6 years.
And stop. Next, after them, we will not vaccinated by pertussis because Alam said early that pertussis is no component of pertussis is not effective for prepare immunity, and the whooping cough is not severe, is not characterized by severe complication in adults. Next, case study. Child 1 month old, live in close contact with long coughing father. Temperature 37.5 degrees, present long spasmodic cough. This person, of course, non-vaccinated. Please listen this cough. Remember about empty lungs.
Yeah. It's think of that one.
Spasmodic cough. They cannot breathe. She has empty lungs now.
Oh my God.
Okay, stop it. Next questions. What the samples and how you will take the samples?
Miss,
Akansha, stop, Sahel. Akansha, please tell us how you will take samples from this baby. No answer from Akansha. Urvi.
Miss.
Mubari present. Urvi.
Yes, miss. Miss, we take a cough sample.
Cough sample. How you will take?
With when we cough and we take a drop of cough and we sample it.
How we call this method?
A plate matter.
Cough plates.
Cough plates. Okay. What the media you will use for a bacteriological investigation? What the media of choice?
Culture media. Bordage Janjao.
Who said? Margot?
The new media.
Yes, ma'am.
Rotating concave measurement.
Thank you.
Okay, Bartel, John, I'm agreeing. How many days you will cultivate?
1 to 2 weeks.
Miss
6 days.
No, about 2 to 6 day. That is
6
1 week to
max,
2 weeks, ma'am.
maximum 3 days. Okay.
Miss
14 days. 14 days.
yes,
Yeah,
Miss
in here, ma'am, 3 to
48
6
to
days.
72 hours.
Yes.
48 to 72 hours.
Yeah.
Okay. Next, how you will differentiate between Bordetella pertussis and Parapertussis? Akash Parmar. What the most characterized properties for Bordetella pertussis?
The incubation period is less, 1 to 2 days.
Okay, long incubation first. Second, if you will use McConkey media, no growth.
It will show negative result for urease and McConkey media.
Tyrosine.
Urease
Tyrosine
and tryptase.
And yes, ma'am.
Next question for Ritika. Explain us pathogenesis of spasmodic cough in this pertussis disease.
Ma'am, no. Is a agent of leaves phagocytosis.
Oh, sorry. Explain. Repeat it, please, again.
Is agents of pathogenesis phagocytosis.
What the virulence factors of Bordetella pertussis do you know?
Agglutinations.
Total 14 agglutinogens is
Next.
and ma'am, the specific one is K antigen with fimbrate.
Yeah, which contain all type of.
But most important pathogenic
Agglutinogens.
virulence factor. Margot?
Agglutinogens.
Not only agglutinators.
Miss pertussis toxins.
FHA, yeah. Filamentous. FHA, ma'am.
Miss adenylate cyclase.
Adenine cyclase.
Miss tracheal cytotoxin.
Cytotoxin.
Liable toxin, yeah, that is adenine cyclase.
And lipopolysaccharide.
And pertussis toxin, PT.
Okay. Who is the source of infection in this case study?
We did not took vaccine.
Live in close contact with long coughing father. Source of infection is human. In this case study, father, because they have a long cough.
Yeah.
Okay, methods of prevention for Sharuk. Method of prevention of whooping cough.
Whooping cough is highly contagious acute respiratory illness of humans, and that is cause gram-negative bacteria pathogens.
Stop. Only prevention, not more morphology.
It prevented by some some distance from.
Miss
But
vaccination.
this is non-specific prevention. Please tell me
Miss
specific.
vaccination.
Vaccination, of course, help. Yes.
Miss DTAP.
That is.
First, we have to treat with antibiotics.
Yes.
That is neutralizing antibiotics. Antibiotics.
TDAP.
First, we have to treat with antibiotics. After that, a specific vaccine, which is called DTAP, from 8 to 12 or 16 weeks, which we call primary vaccination.
Okay, Shivam, I understand that you know this moment, but remember, the immunization schedule is different from for each country. In your country, you should start vaccination in 6 weeks after birth.
Yes, miss.
Okay. Okay, we complete our oral discussion now. Please go to pass final test of Bordetella pertussis and diphtheria. I will open. Now I will send the link. You will.
And this is on this same 10 minutes.
What?
Miss.
Time for test.
10 minutes, because next topic we will start about tuberculosis. Okay? Make a record. Okay, now we should complete our previous lesson. I should put marks. I will count with you. Now I finished to check your student independent works. Next information, the proportion of marks. Tests are 60%, oral discussion of a case study 20%, and your independent works 20%. Now first, Danish, first test 50, second 50, totally 50. We will count for knowledge. 36.
Not submitted.
Next, 40 for oral discussion. Totally 8. Next, your student independent work. First 100, second 90, third 100. Sorry, I will count.
Submit नहीं हुआ यार, third test.
Please, students, don't speak. You disturb. Totally 24 and a half plus 36 for knowledges plus 8 for oral discussion, totally 73. Next, Shivam Kurana, 40 plus 70, 155 total marks. $63. Your oral discussion 85. But you didn't pass two independent works only glossary. It will be 33. 3 and 3.
I put what is not submitted.
But you should send me in WhatsApp as a minimum. Okay. Next, 33 plus 17 plus 3 and 3. Totally 53. Next, Margot Alam. Tests totally 165 will be. $39. 80 for all oral discussion, 16, and 10%. 16 plus 39 plus 10 was 65. Why only 65?
Mubarak.
I will.
Mubarak.
39 plus 16 plus 65 only. Next, Shahrukh for knowledges 55. We will count 63 plus 10 for oral discussion, totally 50, and your C. Oh, sorry, Danish Hussein, I made mistake in your marks. 44. 54, you have total mark. Sorry, I made mistake. It will be 96. Now I will count 43 plus 9. 53. Shahrukh. Next, 75 for knowledges in Sohail.
Yes.
45 plus plus 12 and plus 9.7 equals 67. Oh, sorry, no.
Miss.
It's mistake because you didn't pass glossary.
Miss, I submitted glossary.
No, it's not.
Yes, miss.
Only now. Sorry, students. Akash, Vedika. So hell no, you didn't pass.
Miss, glossary, yes.
No, you didn't pass.
Miss, 1 minute. In
No,
my
no,
laptop
I
there
will
is
not check. Sorry, I completed this lesson. I cannot check your answers now. You should
Okay,
upload
miss.
early. Sorry, no.
Okay, miss. Okay.
I should count because we have the next topic. 103 equals 65. 6. Next 75. 45 plus 12 plus 6 equals 63. Next, Akash. $65, 39 for knowledges plus 10 and only you passed only glossary. 52. Next, Akanksha. 39, 49. Mm -hmm. 49 plus 9 and 6. Totally 59. Urvi. 55. Totally for knowledges. 63. For knowledge part plus 14 for oral discussion. 7 plus 6 plus 6, 53. Ritika. 35. 21 plus 10. But you didn't pass anything when I check. Equals 31. Irfan. 54 knowledges, total mark. 30 plus 12 and plus 9.6, 52. And last Mubarak Khan, 50, 42, and like the same 52 2 also. Okay, now we complete our topic about diphtheria and pertussis, and we will start next topic.